and welcome to Hadassah on Call, New Frontiers in Medicine. I'm your host, Maayan Hoffman. The war against Hamas continues to rage in Gaza, and Israel's young soldiers are fighting on the front lines, some of them for more than 100 days. When the sirens went off in central Israel at the start of the war on Saturday, October 7th, Sar, 27, began packing a bag even before being called up for reserve duty. He equipped himself, put on a uniform, and arrived at one of the training bases in the south. After several weeks of training, he entered Gaza, but one day, as they arrived at a Hamas-controlled building, Hamas fired a missile, seriously injuring him in both arms and legs. He had to have 5 tourniquets to stop the bleeding. Sar was evacuated to Hadassah Ein Kerem and treated in the hospital's trauma unit in serious condition. He underwent 2 orthopedic surgeries and then was moved to the rehabilitation department at Hadassah Mount Scopus. There, he undergoes occupational therapy to strengthen hand function and physical therapy treatments due to leg injuries. Nonetheless, Sar cannot wait to get back to his team and back to the field. "I want to keep improving to get back and fight with my friends and win," Sar said in an interview. I want to take a moment today to also welcome Hadassah's new national president, Carol Ann Schwartz. She assumed her role on January 1, taking over for previous president Rhoda Smallot. Carol Ann will guide Hadassah's efforts to support Israel, fight anti-Semitism, advocate for women's health, champion and support Hadassah's hospital, and help at-risk children at Hadassah's youth villages in Israel. Carol Ann's role becomes all the more important today as the war continues. Today, we have a show on hearing loss, featuring Dr. Michal Kaufmann, head of the Ear Surgery and Cochlear Transplantation Center at Hadassah University Hospital. Hearing loss is something that we discuss a lot in this country because of the loud booms that is going on during the war, the rockets, and the sirens. More than 1.5 billion people worldwide are currently affected by hearing loss in at least one ear, and around 430 million people require rehabilitation for disabling hearing loss. Approximately 13% of adults ages 18 and older experience some difficulty hearing, even when using a hearing aid. With this data in mind, let's turn to Dr. Kaufmann. Okay, so let's start by defining hearing loss. I understand there are several different types.
Yes, well, hearing loss is a broad term that includes various types and degree of impairment in a person's ability to hear sounds and understand speech. It is categorized to levels according to the severity of hearing. For example, mild, moderate, severe, and profound hearing loss. It is also categorized to different types of hearing that are generally based on their different location within the auditory system and the specific frequencies of sound affected. Here are, let's say, the main types of hearing loss. The first one and the easiest one is conductive hearing loss, which occurs when sound wave cannot travel efficiently through the outer or middle ear and cannot reach the inner ear. Common causes include, for example, earwax, middle ear infections, otosclerosis, tympanic membrane perforation, and other structural abnormalities of the external or middle ear. And what do we do about that? Well, it is treatable. That's the good thing. Most of these causes are treatable, and the treatment option may include removal of earwax, antibiotics for infections, or surgical procedures in some cases. The other type of hearing loss is sensory neural hearing loss, which is the most common type of permanent hearing loss and results from damage to the inner ear, the cochlea, or the auditory nerve, or even central connection along the auditory pathways in the brain. Causes can include aging, which causes presbycusis, exposure to loud noise, certain medications, infections, genetic factors, head or ear injuries, tumors, or other neurological diseases that cause insult to the central auditory system. And what about the treatment? Well, it's not really treatable. They are permanent, but hearing aids or cochlear implant may help improve hearing. The other type of hearing loss is mixed hearing loss, which involve a combination of both conductive and sensory neural. This means that there is a problem in both external and middle ear and the inner ear or auditory nerve. The treatment may vary or may include the combination of surgery for repair an eardrum perforation, or any surgery or antibiotics to repair infections, and after that using hearing aids, or using a special bone-anchored hearing aids or implants that bypass the external and middle ear and stimulate directly the inner ear. Actually, nowadays, there are many treatment options for the various hearing impairments, starting from conventional hearing aids to middle ear implants, cochlear implants, and even auditory brainstem implants in cases where the auditory nerve is damaged or underdeveloped. Another type of hearing loss, which is very important to know, is actually sudden sensorineural hearing loss. This is a rapid loss of hearing in one or both ears that typically occurs over a few days. The exact cause is often unknown, but may be related to viral infection, vascular issues, or autoimmune diseases. The symptoms are rapid decline of hearing loss, often accompanied by tinnitus, which is ringing in the ear, and dizziness.
So I want to go ahead and just because, make sure that we are able to cover some of the other.
The main point, just a minute, the reason which I wanted to speak about the sensorineural hearing loss, that it is actually emergency. When you really feel that you lose your hearing in a few days, you must go and check, because this is very important to get the treatment, which is steroid, in the first 2 weeks. That's the window of opportunity.
So does hearing loss impact more men than women, or vice versa by any chance?
Well, it depends. Studies have shown that in general, men are more likely to experience hearing loss than women, especially in the older age. Maybe this difference in prevalence tends to become more because it depends on the cause. Causes of hearing loss can vary, and it can be related to occupational hazards. Okay, men are more likely to work in a noisy environment, like military service, for example, or other factories,
like with construction and things like that.
Right. That's right. Another thing is that there's evidence to suggest that women are more likely to seek medical attention and treatment for hearing problems than men.
Meaning that they would get it earlier, so it would be able to stop it quicker.
That's right. And there are also some genetic factors that can be related to gender. Okay, so generally both are affected by hearing loss, but men, especially in the elderly, in old age, are more than women.
So is there a relationship between age-related hearing loss and the risk of dementia? What are the current theories or mechanisms explaining the connection, if you think there is?
First of all, I would like to emphasize few facts, which is, I think, very important. First, the average life expectancy, that has increased by nearly 10% over the past 4 years.
Just over the past 4 years?
Yes. What? Current life expectancy in Israel, and I think in the other world, in men is 80, and in women is 84. In Israel, 11% of the population are older than 65, and this number is expected to increase to 15% by 2030. So it's really a huge, I don't know, it's a huge fact. I don't know if it's a problem, but from the healthier aspect, it is. And actually, 75% of the population above 60 years suffer from hearing impairment, which begins at the age of 40. and about 1% from severe hearing loss, actually deaf. Okay? And hearing loss, actually in older adult, is the third most common problem, which affect quality of life. And now, there are many, many studies, especially in recent years, that connect or associate between hearing loss and cognitive loss. And it's very, very important to know that, because many, many people do not know, even many GPs don't know that. And it's really, has been shown that it's have 5-fold increased risk of developing dementia.
Wow. So it's related both cognitively, possibly also because you can't hear, so you can't process.
Okay, so there are many,
and
there are few
dementia?
theories about it.
Okay.
There are few theories about it. There's one which is called the cognitive load theory, but it's only theory. It's very, very difficult to really prove it. And the cognitive load theory says that, suggests actually that age-related hearing loss increases the cognitive load on the brain. When individuals with hearing loss struggle to hear and understand speech, they must allocate more cognitive resources to process, say, auditory information, leaving fewer resources for other things, for cognition. Another thing, of course, is social isolation and depression. It has been shown that people with hearing loss tend to suffer 2.5 times more likely to develop depression than in the same age without hearing loss. So it's really, really a big problem. And you have to know that we're getting more older, more healthier, but our hearing system, auditory system, do not know that.
It hasn't caught up.
Yeah, it hasn't caught up. There is aging of the auditory system, which we actually cannot really stop. We only can help. Okay, but it's important to notice that it's very important to do something with it, not just to leave it. And another thing that I would like to know, that only 15% of the people that suffer from hearing loss do seek medical and hearing device. Only 15%.
1/5.
1/5.
So the other ones just sort of live with the hearing loss.
That's right. That's right. There's also okay, there are also some other theories, okay, which depends on brain atrophy, inflammation, vascular factors that we know that that can affect actually hearing loss, or some neurodegenerative processes like Alzheimer's disease, which can also affect the auditory system.
So that's almost chicken and egg in some ways. In one sense, you can lose your hearing, and that can lead to earlier onset dementia. And on the other side, if you have those issues, it can lead to hearing loss.
That's right. And the really recent studies have shown that older adults with hearing loss that were implanted with cochlear implants had better scores in cognitive tests than before the implantation. That's really amazing. This is really new. Okay, it's not, it's about 20 patients that were tested, but it's really new. And they also compare it to those with the same hearing, but that were not implanted. So it really can improve actually their cognitive abilities. Okay, so this is really important to recognize and to be able and to seek actually help.
Want to be a part of Hadassah's National Book Club? If you'll be in the Los Angeles area on February 22nd, you'll want to attend Hadassah's first ever One Book, One Hadassah in-person event, open to everyone. Just think Israel in LA. Our featured guest will be award-winning Israeli author Ayelet Gunder Goshen. She'll discuss her gripping new novel, The Wolf Hunt. It's about an Israeli family living in California grappling with anti-Semitism. In addition to being a writer, Ayelet is a clinical psychologist and will talk about her experiences treating trauma in Israel right now. You'll get to enjoy a few sweets and purchase a signed book by the author. Join us at the American Jewish University on February 22nd at 7 p.m. or watch on Zoom. For more information, visit go.hadassah.org/in-LA. That's go.hadassah.org/in-LA. And now, back to our discussion about hearing loss with Dr. Michal Kaufmann. And how much in terms of, more groundbreaking new research are we looking at? Are we starting to find newer developments or other advances that would be able to help us to grapple with some of the things that you just described and to potentially treat them better or more effectively?
Okay, actually, the latest advantages are multidisciplinary, okay, and involve fields like neuroscience, genetic imaging, and clinical trials. And they contribute to our understanding of cognitive decline in older adults and shedding light on the complex relationship between hearing loss. For example, brain imaging, functional MRI, okay? It was done also in hearing loss and cognitive, and it really shows the connection, okay, between areas in the brain that are related to hearing loss and cognition. Biomarkers research seeks to identify specific biological markers or indicators associated with hearing loss and cognitive decline. These biomarkers could aid in the early diagnosis of both conditions and provide better understanding. And also genetic studies. We know now that actually there are genetic factors that may predispose individual to both hearing loss and cognitive decline. Okay, not only aging, which is different in people, and it's also connected to genetic factors. Okay, well, if you have, let's say, your grandmother or your grandfather lost his hearing, then there's a chance that you will.
So in some sense, that's good, though, because you talked about the need, and we'll talk about that in a minute, for early detection or intervention.
That's right.
And by knowing that there are genetic predispositions, you would actually be able to seek care earlier.
That's right. And also, there's another thing, that there are also environmental and lifestyle factors, which we can really change. Like, there are many studies that were investigating how environmental factors such as noise exposure, social engagement, impact the relationship between hearing loss and cognitive decline. And for example, if we adopt healthier diet or increase physical activity or play a role in reducing risk of both conditions, it's very important.
So let's talk a little bit about something that's just, people have ringing in the ears. Is this normal as we get older, or is this a sign of something more serious?
Well, actually, ringing in the ear is actually tinnitus, right? This is the name.
Yeah.
It is not necessarily a normal part of aging.
Okay.
But it is, in most of the cases, part of hearing loss.
Meaning that if you have it, it's definitely leading to hearing loss. It doesn't mean that you have to get it if you're older?
Yeah.
Okay.
So in any case of hearing loss, you might feel ringing in the ear. You might feel tinnitus. It becomes more common as people get older, of course, along with a deterioration in hearing, but it's not only a problem of aging. The reason why we actually suffer from tinnitus is related mainly from damage to the inner ear, especially after noise exposure. It could be a very loud exposure, like acoustic trauma, but it could be from long time of noise exposure that actually leads to high frequency loss in the hair cells in the cochlea, which is related to tinnitus. Another thing is medication. There's certain medication that do the effect or cause actually tinnitus. For example, certain antibiotics like aminoglycoside, gentamicin, okay, non-steroidal anti-inflammatory drug NSAIDs, okay, that we all take, diuretics, which most of the older people take, and some chemotherapy, of course, that we cannot avoid, but it really causes tinnitus. That's it.
So, I mean, you mentioned diet, exercise, environment having impact on your hearing. What about dental care? Given that, ear, nose, and throat are so connected, is there anything in the mouth or the throat that could somehow be connected to your hearing loss?
Well, not really. Diet and dental care can indirectly impact hearing health, but they are not directly causes of hearing loss. Okay, we must understand this is the connection. However, they can influence overall health, which in turn have an effect on hearing. For example, if you eat only sweets and you have diabetes, okay, diabetes actually connects to hearing loss. Most of the people with diabetes suffer from hearing loss, even if they are younger. The explanation is that in diabetes, you have actually high blood sugar that is, it actually affects neural and vascular. So if you had, it can also affect the auditory system. Some ototoxic medication, okay, also affect this auditory system. And infection, like if you have poor dental hygiene, can increase the risk of oral infections, antibiotics, and
Leads to hearing loss.
yes,
It's like one step removed,
but
but it can be
it's not
not causal.
Yes. Yeah.
Now, in terms of how it impacts your overall quality of life, I mean, you talked a lot about the connection between cognitive, which clearly is going to impact your ability to get through or manage a day, have good social interactions. But in general, how would you say that hearing loss impacts the quality of life for these older individuals? And are there strategies or interventions that can mitigate its effect, both on the cognitive side and on the mental health side?
Well, there are strategies, and very, very important to know that. And for us, and for our relatives, and of course, as physicians or audiologists. First of all, there are hearing aids. Simple hearing aids are the most common and effective intervention for hearing loss. They amplify sounds, make it easier for individual to hear and understand speech. The very modern hearing aids are often discreet and often advanced feature like noise reduction and connectivity to devices. Actually, everything is going by streaming, okay? Like our earbuds, the same. The second thing is cochlear implants. For individuals with severe to profound hearing loss who do not benefit from hearing aids, or those with moderate hearing loss.
I want to stop you for a minute because I want you to define cochlear implant, just in case someone doesn't know what it is.
Okay, so cochlear implant is an auditory device which is implanted, okay, which actually bypass the damaged inner ear and electrically stimulates directly the cochlear nerve. Okay, so if the hair cells in the cochlea are damaged, okay, and you have profound hearing loss, or you don't understand speech, there's another term that I would like to emphasize here, that it's not for profound hearing loss, it's only for also for moderate hearing loss, but those who really can hear sounds but don't understand anything, okay? So in these cases, cochlear implant is the solution, okay? And there is no limit of age. It is very important to know.
Meaning you could get it as old as you want.
Yes, as long you're healthy enough to undergo an operation, but it's not a very big operation. Okay.
Do you have to be put to sleep for it?
Yes, it's under general anesthesia. It takes about 1.5 hours, and you stay for 1 day at the hospital. You go home.
And does not so invasive?
Well, it's invasive in its operation. Yes,
right.
It's surgery, but it's no the complication. Well, it's done in many places, and we here in Hadassah we do it like 100 a year for babies at the age of 6 months to older patients, like 91, it was the oldest patient which we and it really, really helps. And back to your question, okay, after cochlear implants, there's also some communication strategies which we have to know, okay? We have to actually know how to speak with those people. We need to speak them facing them. We need to understand that in loud noise or in noisy environment, they cannot really hear us, okay? So it's very important for us also, and for those patients who know that they have difficulty in hearing. There are also assistive listening devices, okay, such as personal FM system that capture telephones, TV, computers, and it makes it easier to listen in challenging listening environments. Of course, there's auditory rehabilitation by audiologists, okay? And they also have to have some cognitive training, psychological support, and regular hearing checkups. But really, I think that the main problem in older adults, at least in Israel, where I can see it, is actually, I call it shame and prejudice, really.
Against people with hearing loss.
Yes, yes. You know, a patient enter to my clinic. He's 80. He looks very good. He's healthy. He has eyeglasses. Okay. But he doesn't want to wear hearing aids because, people will think I'm old.
Interesting.
Unbelievable. Unbelievable. Right. And it happens really in the area where everybody is going out with earbuds. Everybody.
Right.
Everybody.
So interesting. And also, you said they're very discreet.
Yeah, and they are also very discreet. Really, you can't really see them. But I don't know how to explain it.
The 360 Degrees of Healing campaign is about more than transforming a building. It is about delivering hope. At the Hadassah Medical Organization, we are delivering hope to Israel's mothers and children. At our world-class facilities in Jerusalem, Hadassah Hospital Ein Kerem and Hadassah Hospital Matskopis, we are helping bring thousands of healthy babies into the world each year while providing exemplary care for their moms. We also help keep Israel's children mentally and emotionally healthy so they can thrive. Without the generous contributions of our donors, that would not be possible. Your generosity helps us deliver the many innovative services and procedures provided by a multidisciplinary team and is critical in ensuring Hadassah continues to provide world-class care to mothers and their newborns for generations to come. For more information, visit https://go.hadassah.org/r-pediatrics. That's https://go.hadassah.org/r-pediatrics. And now, back to our discussion about hearing loss with Dr. Michal Kaufmann. So tell me something. I mean, how can healthcare professionals, caregivers, just individuals themselves both recognize and preempt that it's time to address the hearing loss before it's too late? And also, are there any support networks or resources that people can tap into, especially, for example, if they're going to have to get these hearing aids, they don't want them, and they feel uncomfortable?
Actually, first we need to educate. We need to educate people. We need to educate GPs, okay? We need to educate them to know that there's importance of really talking to the patient and asking for seeking help. It's only getting to get a hearing test. That's all. And then they move on. That's really the only thing. Education. That's what I think.
And is there anything specific? You mentioned obviously there's genetics, there's age. These are things that we can't prevent. But are there things that, and I guess work environments to not work in a place that's highly noisy or long-term noise without doing something about it. But are there other things that we can do to prevent hearing loss that people should just keep in mind or take care of on a daily basis?
Well, except for really thinking about noisy environment, okay? Let's say if you use, or everybody actually uses earbuds, yeah? Everybody uses earphones, okay? Even if we don't have any problem with hearing. So there's a rule of 60-60. Do you know what is the rule of 60-60? Okay. So the rule of 60-60, it says that you don't go over the volume of 60%, okay, for 60 minutes. So every hour you have to take off and take
spend
a pause.
another hour or just a pause?
Pause, just a pause. Then you protect your hearing. It's also recommended to use it with noise canceling. So that's because you can actually reduce the volume with noise canceling. And just if you go to weddings or something like that, go with earplugs in your pocket. Simple as that. And don't forget.
Mm-hmm.
Don't forget to put it also on your baby if you take it.
Yeah,
And you can see it really in a lot of places that babies are with earphones, and it's very important because they cannot tell us. They cannot. Hey, it's too loud. So actually, this thing, and that's it, really.
So is there anything else you want to add that I didn't ask you or that you think people should know that we didn't talk about?
I would like to have some speak about some myth about cochlear implant, which I think it's very important. Okay. And to speak about advancement in cochlear implantation. Actually, the technology of cochlear implant that has been known for, let's say, about 50 years or something like that, has been so much improved. So much improved. There's improving of sound processing. We do now bilateral cochlear implants for any children who's born deaf, any child who's born deaf is going into the operating room in 6 months old age and go out from the operating room after 4 hours with 2 ears, 2 new bionic ears. And it's in Israel now, from, let's say, few years. And the latest news is that even a child or adults that lost his hearing in 1 ear is now capable of doing cochlear implant in his ear. This is really new. It's all in the health basket in Israel, actually. Single-sided deafness is an indication for cochlear implant because we know now that we cannot really perform the same with 1 ear, especially children, especially around education and cognitive and everything. So it's very important. Another thing is that there is what we call hybrid or electroacoustic implants. What is it? Some individuals have residual hearing in low frequency range, but severe to profound in high frequency. So actually, they cannot really, they hear half of the words. And it's very difficult. So we use actually hybrid and electroacoustic implants that combine electric, which is the cochlear implant, and acoustic stimulation, which is like hearing aids, okay, for the low frequency at the same machine, the same implant. This is very nice. Also, there is now wireless connectivity for anything, for everything, remote monitoring and adjustment, MRI. Till, let's say, 6 years, all patients with cochlear implant could not do an MRI because there is a magnet. And now all the newer cochlear implant devices are designed to be MRI compatible, which is very good. And it has also longer battery life. And I would like also to speak about some myth about cochlear implant. To be many people come to my clinic and say cochlear implants are only for profound deafness. Well, not, as we talked before. Okay, also for people that cannot understand speech. Cochlear implants are invasive and risky. Well, it is invasive, but the risks are very low, very low. A cochlear implant restore perfect hearing. Is it? Well, not. Well, not. Not. It's not. Well, it's not the same hearing as it's not like the natural hearing, it's electrical hearing, but it really improves communication and understanding of speech in most people that couldn't do it before. Okay? They are not only for children, they're also for adults, and they are not painful. And many people ask me about cosmetic. Well, it has external parts and internal parts. I know that for a few years, many companies are working on fully implanted implant, that nothing is external, but it's not yet in clinical trials. So it will be, I'm sure.
Amazing. Well, Dr. Kaufmann, thank you so much for being with us today. Really appreciate it. And I think people learned a lot from the conversation.
Thank you.
Hadassah on Call, New Frontiers in Medicine, is a production of Hadassah, the Women's Zionist Organization of America. Hadassah enhances the health of people around the world through medical education, care, and research innovations at Hadassah Medical Organization. For more information on the latest advances in medicine, please head on over to hadassah.org/news. Extra notes and a transcript of today's episode can be found at hadassah.org/Hadassah on Call. When you're there, you can also sign up to receive an email and be the first to know when new episodes of the show are released. Subscribe to our show on Apple Podcast, Google Play, or your favorite podcast app. If you haven't already, please leave us a review on the Apple Podcast Store. It only takes a minute, and when you do, it helps others discover Hadassah on Call. This show is produced by the team at the Hadassah offices in both New York and Israel. I'm your host, Maayan Hoffman, and thanks again for joining us today. We'll see you next month.